Hi, my name is Gadau. I'm doing a PhD in evidence-based Chinese medicine at Hong Kong Baptist University. Today, I will show you how I implement the DNA, the distal needling acupuncture, that is taught by Robert Doan in my personal practice. Okay, so Polly here had pain in her rotator cuff and she couldn't really pinpoint where it is. And also she basically had pain all over her knees, but more on like the frontal anterior aspect of the knees, not really on the medial or lateral side, but basically just right over the whole knee, especially when she walks.
Okay, Marcus, so from a Chinese medicine acupuncture point of view, which points did you use to treat her problem?
So if you want to look at it in terms of points for the rotator cuff, we needled here proximal to the metacarpophalangeal joint, which would be your equivalent to, your kind of large intestine 3-4ish. Then here, which would be some extra points. Here you've got Sanjiao 3, and then here you've got Hoxi and Yanggu, Wanggu, and you've got Yangchi and Yangxi on the Sanjiao and the large intestine meridian. But basically, we're going for anatomical regions, and then for treating the knee pain, we have chosen to use, the Shou Yangming treats the Zhu Yangming, so we chose Qu Chi, and we also chose Chi Zi, mainly because of anatomical closeness and to really get down to the joint, but also in terms of system 7, a system 7 you could implement, which would say that the Shou Yangming or the Shou Tai-Yin treats the Zhu Yangming. So this is also relevance from more of a theoretical, traditional Chinese medicine point of view.
Why did you always use 3 needles together, the so-called Daomas, and why not just 1 needle?
So the Daoma comes from Master Tung, and Robert Doan has included that in his DNA simply because of the reason that usually an area of pain, usually the area of pain is over a larger area, so you also want to spread your image, just make sure you get the entire area covered, and that's why we use the Daoma.
You have attended lots of seminars in many different countries. How do you feel that Bob's method has improved your clinical effectiveness and results?
Well, I'm a strong advocate of the distal needling acupuncture in general, whatever methods you choose to learn from, whatever schools, whether it's Master Tung or Chao Chen or Twicken or especially Dr. Tan. But I've seen that, many times using their 1 needle, for example with Dr. Tan, when you only try to use as little needles as possible, it didn't quite bring the results as it is advertised. However, many times it still did. And with the DNA, the distal needling acupuncture that Robert Doan kind of developed and synthesized, obviously you use a lot more needles, but you really, get down to it and truly get rid of the pain. So, I basically, since implementing his method, I really got the best out of all the distal needling acupuncture methods combined.